Good morning, everybody. How are we all today? Well, I am on day 15 of my 21-day challenge, and today I am going to be talking all about the management of colic because yesterday I talked about milk allergies and intolerances, and often these can present in the baby manifesting in colic. So, what is colic? Well, the medical definition for colic is a baby who cries for 3 hours every evening for 3 consecutive evenings over a period of 3 weeks. Now, that seems like a very long time for a baby to be crying, and it is, and it's very distressing for both the mother and the child. Now, colic will normally start quite early on in a baby's life, within 2 or 3 weeks in some cases, and it can last right up until the baby is 4, 5, 6 months old. Now, the reason that colic occurs is that the baby has a very immature gut, and they do get indigestion. And unfortunately, this will happen with both breastfed babies and bottle fed babies. So there is no escape, I'm afraid. Now, we don't really know what is the cause of colic, but the way that we diagnose it is really through the signs and symptoms that the baby is presenting with. So they are very characteristic. So your baby will be uncomfortable. So they will be crying and distressed, of course. But the other signs are that they will have bloatedness in the tummy from the trapped air, trapped wind. They will also be drawing up their legs to their tummy, and they will be going red in the face. And it is very distressing for the baby and for the mother. Now, there are different ways that you can manage colic, and there are remedies and prescriptions that you can get over the counter. And the main one really that I would recommend is Infocol. Infocol is really safe to use. It's really baby friendly because there are no colorants in it. There's no alcohol or anything that can harm your baby. So Infocol is very kind to the digestive system, but it's important that you line the gut with Infocol prior to a feed. And if you can give it 5-10 minutes before a feed, that is the ideal, because what it will do is it will line the gut, the gastrointestinal tract of your baby. And what it does, it's an anti-foaming agent, and it will get all the small air bubbles in the gut, and it will bring them together into a bigger air bubble, which makes it much easier for the baby to expel it. So they'll either burp it up or they will pass it through the other end. Either way, it doesn't matter. It's just really important that we get rid of the trapped wind. Now, there are other ways that you can do it if you don't want to give medication, but that medication is very baby friendly, as I said. You can use baby massage, and some babies find this very relaxing and very reassuring. And the way that you would use baby massage is that you will follow the gut, the intestine, around. So you start at the upper left-hand quadrant and move your way over to the right, and do it in circular movements. Now, I'd really recommend that you go to a baby massage class because that is a really lovely thing that you can do for your baby. And in the case of colic, it really does help to expel the trapped wind. The other thing I would recommend is that your positioning is really important. So when you're feeding your baby, whether it be breast or bottle, do make sure that you wind them effectively. So there are many ways to do this, and I know that many of you are doing this already. So I would sit them upright, bolt upright, and burp them that way. Many parents will ask me, do you do circular movements or patting movements? It doesn't matter, either one. Try both out. Some parents feel that putting their baby over their shoulder to burp is a better way of doing it and more effective. Again, you'll need to try this out and see what works best for you. But do make sure that you burp your baby in between feeds and at the end of the feed to try and expel as much wind as possible. The other thing that can really help is herbal remedies. So I shared this with you before. I used to use chamomile or fennel. Now fennel is a great digestive and chamomile is very soothing. So either one is really good. And rosehip is another one that you can use as well. So herbal remedies are quite effective. I would stay away from anything that has alcohol in it, like gripe water. It's only minimal, but we don't tend to use gripe water or recommend it in a baby under 6 months. Now, unfortunately, with colic, it does tend to build up throughout the day and is worse in the evening time, which is typical, isn't it, when you're trying to cook a dinner and maybe get toddlers and older children to bed or homework or whatever. So it's really important that you've got another pair of hands to help you through that really difficult time in the evening. Now, if you are finding life really, really tough and a crying baby can certainly get you down, there is a charity called Crisis, and I would recommend that you contact them. It's just that there will be other women and men indeed in your situation, and it can really help to be able to talk to people that are in your situation. So I will pop the link to that in the comments. It's really important to look after yourself and to take some time out away from the baby. But the reassuring thing is that colic doesn't last forever and that it does get better as your baby's gut matures. But it can certainly affect sleep as well. Now, I am doing a masterclass on sleep, management of sleep later on today at 12 o'clock. Hopefully some of you have booked onto that, and I look forward to seeing you there. But it's still not too late to get a ticket, so I will also pop the link for that into the comments. So that is my top tips on the management of colic. I hope you found that useful. Please do give me a like or a comment, and tomorrow I will be back here in my business page talking about gastroesophageal reflux, which is another big issue in young babies, and I look forward to seeing you there tomorrow. Okay, take care everyone. Have a great day. Bye bye.